And welcome back. The questions are still coming in about COVID-19, and we're continuing our live virtual conversation with infectious disease expert Dr. Alok Kulay. Thank you so much for staying with us.
Thanks so much, Mike.
All right, our follow-up right now is a question about warm weather. Are outdoor gatherings considered safe? Can people catch this virus outside?
So the overall risk with outdoor events is extremely low. Obviously, you have to be cognizant of the fact what's the rates of community transmission, who are going to be a part of this gathering, and how close is everyone going to be in this particular event or scenario. It also boils down to what's your individual risk level if you're someone who's immunocompromised, and whether you're vaccinated and boosted. I think the overall risk is low. However, you have to take into consideration these other caveats before really entertaining the idea of being a part of such an event.
Now, Angela is asking, will they be recommending boosters for people under 50? And if so, would that likely come in the fall?
That's a great question again, and I think the answer to that is yes. There's a good chance everyone between the ages of 12 and 50 that are eligible for a booster right now, but are not eligible in a way that you're not moderate to severe immunocompromised. Yes, the likelihood is we will all be sort of qualified for a booster coming fall. There's a good chance that the boosters we'll be seeing in the fall will likely be adapted to the then circulating variant rather than the original strain.
More from Angela. She asks, do you think we'll reach the point where COVID-positive people no longer have to quarantine?
That's a great question. It's on everyone's minds. I think it's important to look at it from a public health perspective. I've been asked this question recently. I like to sort of tie it in with, are we in an endemic phase now? Are we out of the pandemic? And I think we're not really outside of the pandemic phase as of yet. If we look at how the influenza pandemic had played out in 2009, I think we're in the post-peak phase where you're still sort of seeing surges. You still know the virus is present in different regions at the same time. I think at some point when we get to a time where, yes, we're aware of the virus's presence, we are waiting to see where you may see clusters and act accordingly. I think that may be a point where we may not have to quarantine everyone who's exposed, but I guess time will tell. We're not there yet.
All right, Dr. Kulay, thank you so much. We got one more round of questioning, though, so don't go anywhere. We'll be right back.
Sure.
Welcome back. The questions are still coming in about COVID-19. We're continuing our live virtual conversation with infectious disease expert Dr. Alok Kolhe. Christina asks, my husband and I both tested COVID positive this week and are currently quarantining at home. We are vaccinated. We've had our first booster. Approximately how long do we have immunity now, and should we consider another booster?
So that's a great question, and thank you, Christina, for asking that. What we know now in the data is infection can grant you immunity. The duration varies. However, I would say that there is evidence to now show that what lasts longer is probably vaccination plus boosting, plus or minus infection. So, and what's going to grant you most protection against subsequent hospitalization if unfortunately someone was to get infected with COVID again is the fact that you're going to be vaccinated plus boosted, because there's a chance that the current infecting strain may not grant lasting immunity against the next strain that we may see. However, we do know that vaccination plus boosting may grant us that. So my recommendation would be, once they're done with their isolation period, and if they're eligible for a booster, that they should go ahead and get it right away.
And here's our next question. We're approaching graduation season with a lot of group events like ceremonies and parties. What is your advice on how to safely attend events like these?
So I think it boils down to three things. It boils down to what's the risk to yourself. It boils down to who are you really gathering with, and what kind of risk may you have to others. I think the third thing you got to take into consideration is what's the level of community transmission. Especially at such events, usually there are people coming in from different regions. So that's a part that gets hard to estimate. I think the reason I say three things is because in my mind, vaccination plus boosting for individuals is a separate entity of its own, and that should be a given no matter what. So I think if you're someone who's at risk from an immune status standpoint, then by all means, you should mask up. I think if levels of community transmission are high, or if you're going to be interacting with individuals from different regions, by all